Hello learners, Dr. Paul here with a brief video summary for Unit 4. So I hope you've been enjoying the course thus far. In this unit we talk about treatment planning, and it's interesting that this unit begins talking about postmodern ideas, because when you start to practice and get into your fieldwork and internship, you'll notice that treatment planning by and large is not postmodern or postmodern informed in most contexts. Most contexts, the treatment planning is very traditional in that it's usually very pathology based. Oftentimes it focuses on an individual in terms of what their problems are. And it's not usually talked about, but treatment planning is very much in line with the medical model: identify the problems, and then state what the treatment plan is to reach certain goals. And it's usually linked to funding. People want to know that they're funding things that make sense from a medical model perspective. In this course, and in your responses this week, you guys did a great job of providing treatment plans for a variety of family therapy perspectives. There was quite a few solution focused, structural. There were some really terrific treatment plans that were consistent with the ideas of those particular models, which is great. Again, the challenges come when you enter field work, and for some of you, you might be aware of this already. The treatment plans tend to take on a much more pathology focus. So this unit's a little bit of crazy making, because we are talking about postmodern ideas that offer a very different perspective, not only on our role as a therapist and interventions, and most notably things like assessment and treatment planning. So moving to most postmodern ideas on treatment planning, we see that it's more based on language and conversation. We note that perspectives and definitions are always evolving in a conversation, and that the goal is not to come necessarily to a consensus of what the problem is, but to keep the conversation going so that the problem context transforms. And Anderson and Galushian were famous for saying that by having a not knowing stance, we can allow a problem to dissolve, because through the conversation, the presenting problem takes shape in such a way that either the solutions appear or the problem itself can dissolve in the conversation. So traditional versus postmodern ideas when it comes to treatment planning are very, very different. And I think it's important that you get exposed to and learn about more traditional assessments and treatment planning, but you don't necessarily need to be constrained about that. And I talked about that a bit in residency, where you can speak different languages as a therapist and still be very effective and consistent and true to who you are as a therapist. So you can fill out a treatment plan according to the way that the people that are funding and reading it will feel connected to the work that you're doing. And you can also privilege your clients' voices and work from a more collaborative metaphor if you choose to. So I think it's important to recognize that as therapists we have some choices to make, and we don't necessarily have to be constrained by some of the assumptions of the context that we're working in, and we can have a voice in those. So I really enjoyed reading your discussion post this week, and just respond to this video that you were able to view it, and if there was one thing that this sparked in you, please comment about that, or if you have a follow-up question, please ask that as well. Okay, great. I'll talk to you soon.